A 21-year-old female presented to the hospital after she noticed a rash. On exam, it's consistent with petechia and purpura. CBC shows thrombocytopenia only. No past medical history. Hemoglobin and all other blood lines are stable. What are your thoughts here? So in this case, I've seen actually 2 cases with something like this. So in the case where you have thrombocytopenia only, you got to think about in these patients, if you have something attacking the platelets only, causing them not to work and not to be present in your plasma. So this is not a bone marrow problem because all the other lines are working okay. You know, your hemoglobin is working okay, your white counts are there, but the patient's thrombocytopenia or the platelets are low for some specific reason. The first thing that you need to think about is, do these patients have something called pseudothrombocytopenia? Okay, so this is just a lab error. There's clumping of the platelets in the tubes, and therefore their platelets would look low, but in reality they're actually not low at all and they're fine. So you just ask them to repeat the lab and just make sure that the platelets are being drawn again and that they're not clumping. There's a huge list of patients that can have, of causes that can cause thrombocytopenia. Big, huge list. What I want you to think about in this case, though, is something called ITP. ITP is immune-mediated cells. So the immune system is basically fighting and killing your platelets. So in these cases, the only thing that's going to be low is platelets, right? It's going to be thrombocytopenia. So you're not going to have anemia. You're not going to have leukopenia. This can happen in patients with CLL. They can happen after having a viral infection. Happens a lot in hepatitis C, HIV, H. pylori. So for some reason, the immune system recognizes the platelets looking like these and therefore starts attacking the platelets, causing thrombocytopenia.